know also a lot of women, just finding out you're pregnant can be stressful, especially when you're not expecting it.
Yes.
Healthcare is super expensive.
It is.
And if you're working part-time or you stay at home or whatever the reason is, you may not have it.
Yeah.
So for any of the ladies out there who might be facing a roadblock of not having health insurance and having just found out that they are pregnant, I know finding a practitioner is very important, someone that you trust. Do you have any recommendations on how they can do that?
Yeah, absolutely. So if you're a citizen of the United States, Medicaid is available to you, and you can sign up for regular Medicaid or you can sign up for pregnancy Medicaid. And this is all assuming that you don't have private insurance available through a spouse or your own job. So if you don't have that available to you, Medicaid is income-based and it's based on the number of people who live in your house. So let's say that you are unmarried, you maybe have a partner, but you're not married yet. And you're pregnant and this is your first child, you count as a household of 2. So you and the baby, even though baby's not born yet, counts as a person. So household would be 2. Of course, if you have another child, that would be a household of 3. If you are married, you can count your spouse. And so all of that weighs into qualifying for Medicaid, also based on your income. They have a chart on their website where you can look and see if you qualify. So that would be something that you could apply for. Sometimes it takes, a couple of weeks to get approved. I would recommend that you go ahead and call an OBGYN who accepts Medicaid before you're even approved for it, because there's quite a few, we're here in Greensboro, but of course all over the place, that take Medicaid, and a lot of them will go ahead and make you an appointment on what's basically called presumptive Medicaid, where they understand that you're in the process of getting approved for it and they can wait and file your claim after you've already been approved for it, which is great. But sometimes it can take a little while to get into the doctor's office because there's so many women waiting for an appointment. So you do want to go ahead and get on their calendar. And truthfully, if you've already applied for Medicaid and you're waiting for the approval to come back in a couple of weeks, well, it may be a couple of weeks before you even get to the doctor anyway. So go ahead and call the doctor. Don't wait for the insurance to come back.